Radiculopathy, sometimes called a pinched nerve, is a nerve issue that is caused by an impairment at the root of the nerve. This can affect the thoracic, lumbar, and cervical regions of the spine. However, this presentation will only focus on the cervical. Roughly 1 in 1,000 people suffer from cervical radiculopathy in the United States, with symptoms including pain, weakness, numbness, and tingling. Cervical range of motion tends to be limited compared to those not suffering from radiculopathy. Behavioral changes stem from the inability to perform functions. So some people miss work and some people don't engage in extracurricular activities due to their pain and weakness. The most common causes are disc herniation and disc degeneration. With disc herniation, it tends to be more prevalent in younger people suffering from cervical radiculopathy, and the older people have more disc degeneration. There are other causes such as tight muscles that put pressure on the nerve and tumors that may affect nerve compression. But mainly 57% of cases are degeneration and 26% are herniation, so that makes up the majority of them. Risk factors include manual labor lifting more than 25 pounds, smoking, or operating vibrating equipment or vehicles. Less common factors are those who possess abnormalities that I've talked about before, with tumors and tight muscles and things like that. Complications of the disease are, as mentioned before, with increased neck pain, weakness, numbness, and decreased range of motion. That both includes the cervical area and your hand and arm. Sometimes the numbness spreads to there. Diagnosis is usually done with a questionnaire and is assessed by a medical doctor. Oftentimes it's followed up with an fMRI or MRI. Sometimes a CT scan is also used to diagnose cervical radiculopathy. In other countries, they have wandered off of this path and only go with the questionnaire. So I did not include any statistics from those studies because they were less reliable than the United States ones. For treatment, it's often found in physical therapy. It includes range of motion exercises, cardiovascular exercise, stretching, trigger point therapy, acupuncture, and so forth. Most of the time, cervical radiculopathy is cured without any invasive treatment. That happens about 75 to 90% of the time. However, some people do have to go in for cleaning up their discs and allowing more space within the nerve pathway to prevent it from getting impaired or pinched. Drugs are also used in the treatment of cervical radiculopathy. They include drugs that prevent the uptake of serotonin and norepinephrine. They also include anti-inflammatories and steroids as well. Those have been proven to be beneficial in the treatment of radiculopathy. And new research has been done that block the receptors of cytokines, but there is no information on if this has been used in any kind of treatment since the research has been done. So how can you prevent cervical radiculopathy from happening? Well, there's several things you can do. You can do cardiovascular exercise, you can do range of motion exercises, you can do stretching, you can have a massage, things like that. That's preventative maintenance things. Things you can watch out for, just be careful of, is not lifting too much, don't get in a car accident and get any whiplash, things like that. Just making sure that you take care of yourself and don't do anything that might put any stress on the spine to where it might close up at all.